It's a pleasure for me to be here. Henrik, in his introductory talk, had on one of his slides, he had the remark, "Don't expect too much from the speakers." I think that was for me. So
that was an appeal to the audience.
Yeah, I'm not a philosopher, so if you are a true philosopher, then you might be disappointed from what I have to say. Actually, when I started in medical school, I was also a student of philosophy, but then I got a couple of children and I decided to continue just medicine and had to stop philosophy and spend my time on various playgrounds with my children. So that was when I formally left philosophy, but I became a psychiatrist, and I think psychiatry is really philosophy in practice. When I talk to philosophers or I listen to philosophers, I always have the problem. Now, what do I have to do with that? What is the practical implication? What makes what consequences do I have to draw for a better life? And that's what really psychiatry is also for me. It's a field in which you apply philosophy to real life, to the interaction with patients, and also to your own life. Now, that doesn't seem to work. Okay. Oops, that was too fast. Oops, wrong direction. Okay. Now, when I usually go to, in December, every year in December, I go to the meeting, the annual meeting of the American College of Neuropsychopharmacology. I have been a psychopharmacologist from the very early beginning of my residency in psychiatry, so many years ago. And this is really, for psychopharmacologists, this is really the premier meeting. You spend a week at a very nice place on the ocean, and you get inspired and get all the really current knowledge in psychopharmacology. And that was also the case. I go there every year. I think for the last 15 years, I have been there all the time. This year it will be online, and I won't go. So the meeting usually begins with a symposium, a President's Symposium. The President's Symposium in 2018 was the opioid crisis. What solutions can science contribute? So the opioid crisis, as you might know, means that a lot of people in the US die from an opioid overdose, and that the numbers are steadily increasing, or at least until recently. 20 years ago, the US had 1,000 opioid overdoses per year, 1,000 per year in 1997. 20 years later, in 2017, they had 1,000 deaths.
Right now, your head is a bit lower, so it can be funny.
Per year.
But
That's
you can also lay on
crisis.
the other side and try if it's better.
So
and
I was sitting in this symposium meeting, and that's me. This cartoon was created by a graphic artist from Springer Verlag, Springer Press in Heidelberg. It will be in a book which will come out in a couple of weeks that I wrote. And I tell a little bit of a story in that book. And this is from the introductory chapter. I explain exactly the same story, why I wrote this book. I was sitting there in this plenary lecture, or in this plenary section, 6 speakers, 6 top-notch American speakers, including the director of the National Institute on Drug Abuse. And all these 6 speakers were talking about the brain and molecules and opioid receptors and drug development. There was nothing about the societal or environmental causes of the opioid crisis. Really not a single talk. They were really thinking that the solution of the opioid crisis is in the brain. In the New York Times, I sometimes read the New York Times in March 2019, there was this article, "Death from Drugs and Suicide Reach a Record in the US." So it's not only opioids, it's also suicide. Suicide numbers are increasing. Here you can see more than 150,000 Americans died from alcohol and drug-induced fatalities and suicide in 2017. And in the same newspaper, in the New York Times, there was a little bit earlier, this article, a couple of months earlier, actually a few days before this opiate symposium. Can we stop suicides? It's been a long way since there was a new class of drugs to treat depression. Ketamine might be the solution. So ketamine is the solution, at least for this writer, for the suicide crisis in the US. That's really very naive and stupid. I would call it stupid to call a drug the solution for such a problem. Now I would like to show you a brief video that was a presentation that was given by Elon Musk. Probably you heard that Elon Musk a few days ago gave a presentation on Neuralink. Neuralink is a brain chip. You implant it that's his vision. And of course, everybody like Frank Thelen, the investor, likes him very much. You just put a chip into the brain. He shows only pigs, but the vision is that you do the same to humans, and then you solve all the brain problems. And according to Musk, depression and anxiety and all that is brain disorders. Can I see the first 2 minutes of that video? In the first minute, he will explain the major message. So
I'm really excited to show you what we've got. I think it's going to blow your mind. All right, welcome to the Neuralink product demo. I'm really excited to show you what we've got. I think it's going to blow your mind. So the primary purpose of this demo is actually recruiting. So I'm going to emphasize this at the beginning and then again at the end. We're not trying to raise money or do anything else. The main purpose of this is to convince great people to come work at Neuralink and help us bring the product to fruition, make it affordable and reliable, and such that anyone who wants one can have one. And so I want to emphasize the purpose of Neuralink. Like, what's our goal? Our goal is to solve important spine and brain problems with a seamlessly implanted device. So you want to have a device that you can basically put in your head and feel and look totally normal, but it solves some important problem in your brain or spine. And the reality is that almost everyone over time will develop brain and spine problems. These range from minor to very severe, but if you live long enough, everyone's going to basically have some kind of neurological disorder. And these range, from memory loss to brain damage. But the thing that's important to appreciate is that
okay, I think
an implantable.
We can stop here. So the essential, that's the essential. Oops. Yeah, that's the essential message. He can solve all these problems here, including depression, anxiety, addiction. Addiction, opioid crisis, according to Elon Musk, we won't have an opioid crisis in the future because everybody will have such a chip in his brain, and we will never suffer from mental disorders again. That's his vision, and that's depicted here. That's psychiatry of the future. This cartoon was drawn before Musk gave his presentation. And that's basically what the colleagues at the ACNP meeting presented. All these psychiatric disorders are brain disorders, and we fix them by correcting deficits or defects in our brains. Mindstrong Health is the company of Tom Insel. Tom Insel is the former director of the NIMH, the National Institute on Mental Health. He directed that institute for 13 years before he went to Google and then to Mindstrong. When Tom Insel left the institute, he admitted that he had spent $20 billion on cool science, that he had written cool papers in top journals with very high impact factors, but he also admitted that he had basically done nothing to patient outcomes, that he did not reduce suicide rates. During his presidency of the NIMH, and the suicide rates were rising. And now he is head of a company which declares brain health equal to mental health. We believe brain health is fundamental to our mental health and overall health. We believe good mental health empowers us to live our best life. And then, so it's a digital company. And now he believes that by getting the digital signals from our smartphones, we can improve our mental health. That's the big question for me. Brain health equals mental health. And this is really related to the mind-brain problem. How is mind or consciousness related to brain function? And that's what we deal with in psychiatry. That not every day when we talk to a patient, but in principle, we are dealing with exactly that problem. When we treat a patient with a medication, are we correcting a molecular deficit in the patient's brain, or are we facilitating something? And that's really a very crucial question. And that's also, that's basically the vision of Tom Insel. We don't talk to the patient anymore in the future. We detect digital signals from, or biomarkers. You know, we detect biomarkers from electrical signals or the blood. And from that, we make a diagnosis. We characterize the patient with big data. Big data is also a big fantasy in psychiatry. And then we make a personalized treatment to the biology of the patient. Psychopharmacology originates about 60 years ago. 60 years ago, we got imipramine, chlorpromazine, and all the initial drugs that really changed psychiatry. And from those developments, biological hypotheses of depression, of schizophrenia, and related disorders were developed. And that's basically what biological psychiatry is. We conceptualize psychiatric disorders or mental disorders as brain disorders. And that's really, oops, what happened? It's really, the question is, how can we relate that's a normal state, that's a depressed state. We believe that a depressed state is related to reduced neurotransmitter in the synapse. And then we block the reuptake of the neurotransmitter into the presynaptic neuron. We increase the transmitter content in the synapse, and then we get reuptake inhibition, and the patient is normal again. The problem is, how can I bridge the gap between the biology and the mental state, the suffering, the individual suffering of the patient? And that's really the problem, that's the mind-brain problem. How can we translate biological function into mental function, into consciousness, and personal, individual suffering of the patient? That's what I'm dealing with. So Daniel Dennett, that's one of the famous consciousness researchers, a philosopher. I read, or I tried to read that book many, many years ago. It's from '93. It's still an actual book. Daniel Dennett more or less explains consciousness as a function. He's at least in my impression, he's a materialist. So we don't need consciousness to explain anything. It's just an epiphenomenon of brain function. And that's really the concept in biological psychiatry. We don't need consciousness. We treat dysfunction, and by dysfunctioning, by correcting dysfunctioning brain circuits, we improve mental illness. Now, this book is from Thomas Metzinger. It's not one of his first books about Bewusstseinskultur. It came out in 2010, and that's from the introduction. In this book, I will try to convince you that there is no such thing as a self. Contrary to what most people believe, nobody has ever been or had a self. But it is not just that the modern philosophy of mind and cognitive neuroscience together are about to shatter the myth of the self. It has now become clear that we will never solve the philosophical problem of consciousness. That is how it can arise in the brain, which is a purely physical object, if we don't come to terms with the simple proposition that to the best of our current knowledge, there is no thing, no indivisible entity that is us. So he is claiming that there is no self. And that's the book about, more or less. I don't know whether he's right. My patients don't care whether they have a self or not. my patients suffer. I don't care whether they have a self. I have the impression I have a self, and I'm getting around with it in my daily life and when I'm treating my patients. And that's basically what I believe, that's practical philosophy of psychiatry. So everyday philosophy. I want to improve the lives of my patients, and that's it. They don't care whether they have a self. But I'm sure they have the impression that they have a self, a suffering self. Now, what my point is that there is biology, and of course, mental function is in some way related to brain function. But how we feel, and that's impressed in this state here, which you probably know what is depicted here, is the fact that for me, consciousness is not only related to my brain, but also to my embeddedness in the world, to my relationships to others, to my surroundings, to my environment. That all is very much important to what I'm feeling, how I feel as a self. That's not only my brain. I'm not isolated in an isolated individual, but I'm part of my surroundings, of the world. And that's consciousness for me. It's a mediator between my brain, myself, and the world. And how we, how we create our environment is important for our well-being. It's now very clear that our environment is one determinant of our well-being. There are other determinants, like how do we relate to each other. This is Elon Musk's world. You are an individual, and if you feel sad like this one, you just stimulate your brain chip, and then you are doing better. This is the world how I see it, and that world can be created not by interacting with or by challenging the brain, but by creating an environment in which people in general feel better. And that's also how, for example, how we interact in school or in our work environments. That is now also a very actual picture. I have spent many hours in my home office over the last couple of months. I'm pretty sure that this also, how we interact with each other is very important for our mental well-being. So there are many factors that are important determinants of how we feel in the world as individuals in a complex world. Yeah, that's probably a bit conventional, but what I want to say with this final cartoon is that we have the power to create a better world by creating a culture in which consciousness is not just a function of our brains, but a function of our interaction between the us in an individual and our surrounding world. And psychedelics will not be the solution. Psychedelics will not be the solution for any mental health issue. There are investors out there. They are claiming let's erase mental health from this world by psychedelics. That's really nonsense. That won't happen. But psychedelics can lead to states that not only, of course, they have also biological actions. I'm pretty sure they have biological actions, which might be very important. But they also have effects that lead to the feeling that mind is stronger than matter. Yeah, that's my point. Thank you.